Good evening, viewers. Hope all of you are doing truly well. This is something which I always like to ask you, though these are tough times, even then, I guess all of us are trying our best to stay well and stay fit. And while we are doing that, I want to give you a quick first introduction to our True Wealth Health initiative and our channel. And a quick disclaimer. And of course, we are here with a special program that is the quarantine queries, because these are the times a lot of us have been infected and we do not know. We have a lot of questions. We know a lot of things, but we still have a lot of queries on these lines. And we are going to be joined in by two absolute experts who are one, of course, in the infectious diseases and, of course, a psychiatrist. And I'm going to also try and make an attempt to give you some insights on nutrition. Having said that, I don't want to even take a minute more and first give you an introduction. Uh, as uh, as some of you know, and some of you who are new, True Wealth Integrative Health TV is an initiative of True Wealth Integrative Healthcare, which provides integrative health and personalized nutrition advice to control, prevent, and reverse lifestyle, autoimmune, as well as infectious diseases. True Wealth Integrative Health TV shares authentic knowledge and wisdom from healthcare and nutrition stalwarts to help you separate science from hype, especially through the social media explosion that we are experiencing and the sudden health and nutrition wisdom. So you can actually make the right health and nutrition choices. Rightly so, we have two special experts and guests with us. Dr. Priti Pillai. She is consultant medicine and infectious diseases with Jupiter Hospital Thane and Bethany Hospital Thane. Her qualification, she's of course MBBS, DNB, FNE, and she has a specialization in infectious diseases from the Hinduja Hospital again, and more than 8 years of experience in this field. And of course, she has been extensively practicing in Thane. She has authored a lot of chapters, especially a chapter in the API textbook. Also, she's authored a chapter in the epidemiology of COVID case book with Dr. Again, a very big name, Dr. Rajiv Soman. And she's written a lot, many articles. She's been doing a lot of programs trying to educate people, especially through COVID. And then, of course, a prominent figure again, Dr. Shailesh Umate. A lot of us have heard him before, but we are very happy to have him on the show today. He's the director of Insight Mind Care Hospital, which is a 40-bedded psychiatric nursing home, very rare when it comes to psychiatry. And he's a practicing psychiatrist in Thane since 2009, and he's attached to Thane Healthcare Hospital and Kaushalya Hospital, and also the very well-known Institute for Psychological Health, that is IPH, since 2009. He's also a consultant psychiatrist, as we know. He has a formal education from the Nair Hospital. He's an MBBS, and he has a DPM from the KEM Hospital, DNB from Messina Hospital, and he has been a consultant with the Railway Hospital as well, and an assistant professor again at many places. That is the Grant Medical College, which is JJ Hospital, the KM Hospital, and Cooper Hospital. And he's been teaching for quite some years, and he has a special interest, of course, in drug de-addiction, sexual disorders, and many much more. He's a regular at so many TV programs and newspaper columns, and a lot of you might have seen and heard him. He's also, educated the judicial, so the legal advisors, and has done a lot of work with the awareness programs with the District Legal Aid Society, Thane Family Court, Bandra, and a lot more activities that he does. He's also has been co-chairperson and secretary with the psychiatric societies. So trying to keep his introduction short, a lot more to say about them. And of course, I am Rajashree Gadgil, nutrition expert, founder of, and CEO of True Wealth. I have about 20 years of global experience in nutrition formulations, also in continuing medical education. I have a master's from the Science Hospital as well, and I have globetrotted. I do have experience in areas like orthopedics, therapeutic nutrition, gynecology, gastroenterology, and a lot more, even infectious diseases, which is why rightly so we are here. And I want to, on that note, bring onto this virtual stage Dr. Shailesh Umate and Dr. Priti Pillai. I'd welcome you if you can actually switch on your videos and unmute yourself. It's such a happy feeling through these really turbulent times to have you here. I'm sure a lot of people are going to be relieved seeing you all here and going to hear a lot that we are going to discuss. But before I really jump onto the bandwagon of so many questions that we have, and I've also got a lot of questions for people. If you would like to, Dr. Shailesh Umate, if you would like to start by saying a few words, because right now we all are in such a negative mood. If you could start the session with a few positive inputs, that would be great.
Rajshri, first of all, thank you so much for that warm welcome, and welcome Dr. Priti. Yes, it is a difficult time for all of us, including doctors and a common man. For all the people, some or other ways we are hassled by this time. My saying is always, tough time doesn't last much, but tough people do. So definitely, this tough people means not with some kind of good muscle building and all that, but mental structure or thought process basically. So anybody in any situation can alter their thought process. It is not that you're born with that, but you can definitely learn the ways of being tough and can handle the situation. And definitely you can upgrade always. So it is not that I don't have that in me, but definitely any moment of life you can learn that and become a person with wise thoughts. So that is my take home to the people now, and with this we can start definitely our discussion.
Yes, and I want to also want Dr. Preeti to say a few words, especially with the fact that you've been relentlessly working in this field, and it seems like it's never ending. How have you yourself been staying so positive and so energetic?
As rightly said by Dr. Umate, it's about learning as we go. Okay, we were shocked by the first wave with the cases coming in and not knowing how to treat. And during this last 1 year, all of us have learned along the way how to manage patients, how to remain stable during these tough times, loneliness, isolation, dealing with elderly, and every one of us have learned it. Just not us physicians; it's our residents, our nurses who have. I mean, our residents and nurses are our pillars for managing our patients more than us. So we have all learned along the way, and that's the only way to come out of this phase as well, even with the second wave. Just continue to learn, remain steady, do your job. Everybody does their job, and we'll just move on. It'll just be over in a few weeks' time.
Well, that's really a positive feeling when you say that it's coming from you. But the fact that the second wave has resulted in such a huge surge, and we are hearing again, we would like to know confidently from you that is this a new strain, and if the new strain, is it more like it's more infectious? Is it equally more deadly? Is it airborne? All these questions are completely driving us mad, you can say it right now.
Okay, so I mean, we are not sequencing every patient who's tested positive to really say whether everybody is having some mutant strain. Now, mutations are the way the viruses evolve. So, irrespective of whether they're infective or whether they are more virulent, viruses evolve over time. The way we have learned over time, even the viruses are evolving over the last 1 year. Now, whether this evolution of the virus, whether it translates to greater infectivity, or whether it translates to greater, more severe illness is not really, determined scientifically. All we can say is that we are having a spurt of cases, explosion of cases, and possibly the link is with our own behavioral, somehow along the way we have forgotten that COVID appropriate behavior, which has been reinforced from the beginning. Okay, avoid crowds, keep distance, and follow masking. And maybe that's the reason, because the first lockdown we did it really early, so we were able to stagger the cases over months. And suddenly this lockdown happened when the explosion is already there. The cases are already there. There is no real indication that it's more infective. There is no real indication that it is more virulent. But the explosion of cases that has happened, it is not balanced with the amount of infrastructure or healthcare access, or the ability to screen and test and treat everybody. And that's the reason why we are seeing more severe forms of illnesses. But it's very difficult to really determine that it's more infectious in any way.
Yeah.
Okay, there is some worry about with some immune escape, like people who've had COVID have come back, but the reinfection rates are really low. We are right now, what we are seeing cases, we are seeing it in the high rises. The slum pockets where they were clustering in the first wave is not seeing as many cases as we are seeing in the high
Yes.
rises.
Yes.
So it's not more of reinfection. It could possibly that the people who are at home now has forgotten those COVID appropriate behavior and come out in public, enclosed spaces, the dining, the malls, and that has possibly contributed to the sudden explosion. And when you have sudden explosion, you compromise on the facilities that we have. So that's what's happening right now. Really not easy to say that it's more infectious. I think what's more we have to stress on is COVID appropriate behavior. So those crowding, explosion, those are the things that we have to stress on.
So rightly so, when you say behavior, we have to turn on to Dr. Umate, because psychosomatic is something we know in the medical parlance, but you know it much more and you see it a lot. So when we say lockdown, 1.0 and now 2.0, or you say this is the second wave, are you seeing some differential behavior, and do you think this psychosomatic influence is also aggravating the severity of the disease?
Uh, Whether it is related to severity of the disease or not, Rajshri, that I cannot definitely tell you. But yes, the behavior which is there during this lockdown 1 or lockdown 2 is always the human behavior. Okay, some defenses come into in your mind and they play mind games like that. So initially, yes, initially there was a lot of panic. Okay, and if you see, the world of WhatsApp was full of the messages of the panic from all over the world. Okay, so people were really scared. So they were really scared that they really cannot go out and do some work or whatever. So they were remaining into the house and was not doing anything. So slowly what has happened, again, the rumors take a toll. So slowly what has happened, they started believing that, okay, it may not be that problematic. So why you're just getting so much scared? Come out. Okay, let's go. So some people started again, the WhatsApp University started circulating a different message. There is no COVID. In fact, if you say there are people who believe that there is no COVID, it's just hoax. Okay,
Yeah.
so COVID is hoax, COVID is hoax. So that way there are a lot of people circulating these messages. And after that, there will be a lot of people circulating the messages that it is just a conspiracy of a government, a conspiracy of a doctor. Okay, so the government is probably getting money, doctors are getting money. Again, people started not believing whether it is a COVID or not. So the moment you don't believe any disease is there, you are not scared. You become a bold. The moment you become a bold, as Dr. Priti has very well mentioned, that COVID appropriate behavior goes down. So you don't wear mask, you go out, you don't take precaution. So initially where people were too much scared, now people here are not scared at all. These are the two extremes which we saw in the first wave or first lockdown. Now the same thing is happening in the few people who got infected in the first wave. They started believing that, okay, rest of the world is not doing well, but India is doing well. We have got so much of population, but we have got so much less infection. Probably we are immune. So again, everything we started opening, and bus started, train started, mall started. Uh, Everybody, it was crowd, and definitely it is going to increase the uh, number of cases the moment it gets a new population. Okay, some population who's exposed to the disease probably develop some kind of immunity, but new population, it is going to spread fast. That is what the nature of the disease is. So the moment the COVID appropriate behavior had gone down, again the number of cases has increased. So I see the behavior of the people are too extreme. Either they are too scared or they are too bold. Both the behaviors will not help you. If you're too scared, probably you will not work at all. You will be just locked down yourself in a house. There is no implementation from the government, even though you'll sit at home and do nothing. If you're too bold, you will roam around everywhere, not taking it seriously. So it has to be somewhere in between. You have to understand that yes, there is a disease. It can happen to anybody. How you can protect yourself is by taking precautions. Okay, that is what you need to do. And probably this taking precautions may long last. It is not that just next 6 months we have to take precaution. It may that next 1 year or 2 year we have to take precautions. And it may happen that it might become our lifestyle. If you look at the East, Japan and few countries, in fact, SARS has taught them a lot. Okay, so in this Corona times, there are less infection in these countries because they have developed a lifestyle of wearing a mask. If you look at the Japanese people, they wear mask everywhere. That has become their lifestyle. Okay, so probably that's why the COVID is less there. So if you change our lifestyle, in fact, it's a healthy lifestyle. Wearing a mask is a healthy lifestyle. We doctors also have forgotten to wear a mask when we are going to hospital. But now, yes, we are developing that habit. So again, rather than going from two extremes, you have to find a middle path that there is a possibility of a disease. You can get the disease, but what you can do is you have to take precaution. Apart from that, you can't do anything much. So that is what you have to tell yourself, and you have to go on with this. So you were talking about this psychosomatic. So with this all what we have seen, the moment this kind of illnesses come, Dr. Priti also might agree with me, the symptoms of COVID might mimic in some patients. Some patient will tell you that, doctor, I'm feeling fever. Fever probably is this a COVID. If we check with the thermometer, there is no fever. But yes, the patient complains of a fever. That is a psychosomatic. Sometimes patient complains of breathlessness because people are aware of the many symptoms of the COVID. Then they complain of breathlessness. But if you check the oxygen level, it is definitely fine. But the symptoms are there. So these symptoms, there is no evidence of clinical signs when we examine the patient. So, but this patient is having the symptoms, and that is distressing to the patient. These symptoms, we call it as a psychosomatic symptoms. Definitely, many of the people have a psychosomatic symptoms. Many people who have suffered from COVID, they also have. Many people who have not suffered from COVID, they also have a lot of kind of psychosomatic symptoms. Yes.
Sure. So I think very, very rightly raised point that, in the other countries who've already suffered these kind of pandemics, they are more used to this kind of lifestyle. And we all have to understand that this is sort of going to be a normal. Yesterday, I was just talking to someone and someone asked me, how is it going? I said, I don't know. Was that a normal, or what we are going through right now is normal? So our normal has to sort of be between both of them, and we have to learn to be that way. And it's great understanding these facts from you. And while actually we now go to the quarantine discussion, because this is something which because it's more infectious, as Dr. Preeti mentioned, that more number of people are getting infected, and then we do not know how we should really quarantine ourselves. We don't even know when we should test. So to begin with the test, Dr. Preeti, if you could tell us, when does one want to go ahead and test? Because again, there is so much confusion. Someone says that you should have tested before, then someone will say, oh, but there was no need to test. So what's the right time to actually go and test?
So with the raging pandemic that's going on, everything that is fever is right now COVID. I mean, should be the first suspicion. So if you have COVID symptoms, you should test yourself. And you have to also understand that the test itself is not going to be 100%. Every patient with COVID will not be diagnosed by that PCR test. It has its ability to pick up a patient with COVID may range from 60 to 70% based on when you do the test. Maybe when they're symptomatic with fever, body pain, you may pick up more patients. But as the days go by, when you do it late, by the time the pneumonia develops, you may miss many patients. And a lot of times this virus, the genetic material of the virus remains in the nasal nose enough that you may pick up somebody who is asymptomatic even 3 weeks down the line, who may have missed having those COVID symptoms. And almost 50% of the people who get infected are actually asymptomatic. So when should you test yourself? If you have symptoms. So what are the symptoms? Not everybody will report a fever. So if you have fever, if you have loss of taste and smell, if you feel extremely tired, if you have severe back pain, leg pain, or if you notice that you've been like elderly, especially, they notice that they've not been eating well, they've been vomiting, there's loose motion, they feel extremely fatigued, tired, they're just sleeping, and this is a new onset symptoms. They were okay a few days ago and now this thing has started. As of now, in this pandemic scenario, you treat them as likely COVID suspects, and such people, if they are symptomatic, they should be tested. So I'm talking in relation to who, in terms of patient management, like when do I suspect a patient has COVID, these are the symptoms to watch for. If somebody comes positive in that family, then you kind of have to test the entire members, because family clustering is the most important thing. Anybody in the family, if you have see any significant contact more than half an hour without mask within 3-6 feet distance is considered significant exposure. And anybody, people may get symptoms even before the symptoms, 24 hours prior to that, they must have affected their family members. So all family members are considered likely COVID suspect as soon as somebody is positive in the house. By that standards, you should be testing family members. Now, do I test all family members? If they are asymptomatic, you may decide not to test them unless they have high risk of a severe disease. See, the disease itself is this way: 50% asymptomatic. Can you excuse me for a minute? Just
Sure, sure. I am going to actually, Dr. Umate, on that point, while she's talking about the technicalities, how does it pan out? Like, we're seeing that people are scared to even get tested. And I know you've been talking about over testing as well. Should we let Dr. Priti complete her point?
Yes,
I'm
yes,
so
yes,
sorry.
yes.
No, go ahead, go ahead. Please go ahead.
Yeah. So see, basically,
Well, I want to comment out here. These are the new rules. So you're at home. You have to excuse all this, and we're at work at home. So you're all excused. Please go
so
ahead.
sorry. Yeah. So basically, when you look at the entire spectrum of COVID, 50% patients will not report symptoms, 50% will report symptoms. Out of those 50%, 80% patients will have only mild disease. So they may report these slight pain and slight fever, 9900, and then become better. Or a few days down the line, they may report some loss of smell, loss of taste, mild cough, and again become better. Throat irritation get better. So when they get tested, the entire family is also at risk. So you test the family. Now, with paucity of tests being available, do I test all my family contacts? Basically, all family contacts should be considered as highly suspect, but you can test people who have high risk of progressing to a severe disease, people who are obese, anybody who has a very high BMI, even if they don't report symptoms, are likely to get severe disease. So 10% of people who don't report symptoms still may get severe disease. So anybody who has high risk factors, obesity, males are more prone than women, then people with diabetes, people with kidney disease, all those elderly with multiple risk factors, whether it is related to liver, kidney, lungs, all those things. So anybody with an underlying disease or who has age above 50, diabetics, and people with obesity, they are at risk. So better test them. So we will be more vigilant about them. If they are like young kids, asymptomatic, and then you don't test them till they report symptoms. If they report symptoms, again you test them. But irrespective of whether you're testing or not testing, all family contacts are considered highly suspects. They should be quarantined with the patient. When we talk about isolation and quarantine, isolation is what we do to somebody who's infectious, who's tested positive, or who is symptomatic. As soon as you report symptoms, in the interest of your family, it's important that you isolate yourself. Even before you call for reports, even before you get all the tests done or getting diagnosed, the earlier you isolate from rest of the family members, better would be for the rest of the family members who not been exposed. Especially stay away from elderly, pregnant, and high risk people. Now, quarantine is what we do to people.
We'll go. Give me a few seconds. I want to get Dr. Umate's view on the testing side also, and then we all want to know what you're going to tell us. But Dr. Umate, while testing again, that's one thing which is a big issue, that there are people who still not getting tested, and a fear is still there that if they get tested, next what? I mean, are they going to have to get hospitalized, or is it going to be a chaos? A lot of people are avoiding. I've seen circumstances where people are trying to manage another COVID patient, and which is why they're just avoiding to test, because if they test positive, then it's going to
Priti,
be another big
Rajashree,
story.
hi.
Yeah, We can hear you. Did we lose him? Dr. Umate, am I audible to you? Oh, okay. Looks like we've lost him for a few minutes, but on that point, I think we'll wait to take his view on that, and a couple of questions on testing for him. But meanwhile, I think Dr. Priti, I'm sorry, I actually interjected you, but if you can tell us, are you back, Dr. Umate?
Yeah, I'm back. I missed some of your points.
Yes.
I don't know why.
Yes.
I was not able to. Yep.
No problem. So I'll repeat my question. The question really was that through these times that, when testing, we're insisting on testing, at least, when you have Dr. Priti gave us such an extensive understanding of when we should test, and still people are not testing. They are worried with the fact that if they test, then it's all a psychological thing, which I realize, and all of you all are realizing, that people fear that if they get tested positive, then they probably will have to go to the hospital. If there's a senior person in their house, they're again worried. There is a lot of different type of worry. And then you also did mention that people are a little paranoid about testing. So if you can explain to us how should we look at this whole testing scenario?
Yeah. See, as very clearly mentioned by Dr. Priti, that very clear guidelines when you have to test. Okay, but at the same time, people are very reluctant to get themselves tested. That is because of the stigma that the society is posing. In the sense, it was very high in the first wave. Like the moment you get the corona positive, maybe you are disowned from your society. Society will keep a watch, or they will kind of isolate you. They will not interact you. They will look down upon you. These kind of all things were there. And initially we had some news about all these things in the media also. So that's why people are scared. One thing. Second thing, people also are scared that what will happen if I get positive. I mean, whether I will be treated or not treated, or what I should do. They're confused. So one is pressure from the society. Second is their own confusion. And third is not believing in the doctor. Whether doctor is saying anything. ऐसा थोड़ी होता है. अभी तो मेरे थोड़ा सा खांसी है. ऐसा खांसी तो कितने साल आया है. अभी काय को इतना ये करने का. ऐसा बुखार तो कितने साल आया है. So sometimes they don't believe in that and they don't test it. And what happens? So if it is, as very Priti said, 80% of these cases are mild. So in 3-4 days everything goes down and they are well. And then they blame, अरे क्या डॉक्टर कुछ भी बोलता है. 4 दिन में एकदम अच्छा होना एकदम. But by that time, how many people they have infected, we don't know. They are all right. Okay. But again, that confirm their belief that कि ऐसा COVID कुछ नहीं है. Okay. So then they start telling other people, no need to test. मेरे को तो ऐसा बोला था, मैंने तो कुछ किया नहीं. 4 दिन में मैं अच्छा हो गया हूँ. देखो, अच्छा खासा हूँ. So again, because the cases are mild, people, yes, they do get better without any medical intervention also. But what we are worried about is spreading the infection in the society. Okay. What we are worried about is what Dr. Priti has very rightly said, the high risk people, high risk population. In fact, obese, diabetic, elderly, people having kidney diseases, these are the people who are at risk. These are the people who are at risk of losing their life. Not the children, not the adolescent, not the healthy adults. Okay. So probably these people may not have anything, but they might infect other people, causing a burden on the society. So in fact, you have to reverse the psychology here. If government can implement to isolate who are high risk people and to kind of make other who are healthy people to walk around here and there, that can create immunity faster. But it takes a lot of time, and it needs their views also. Now, apart from this, some people are extremely fearful about the disease, and they feel that they have been infected by COVID. So they try to get tested themselves repeatedly. And their test comes negative. They go to Dr. Priti and tell her that, doctor, I'm getting fever, I'm getting cough, I'm getting this and that, but my RT-PCR is showing negative. Definitely, I'm having COVID. You please treat me. Okay, Dr. Priti will examine her and say, nothing wrong with you. You don't have COVID. Please go and enjoy. then they won't believe. They will go to Dr. Priti again. And after 3-4 times, Dr. Priti will say, get lost. I have got a lot of serious patient to admit. Okay. Then they will find out another infectious disease, and they will go again test it there. And they will say that, oh, my test is negative, but I feel that there is a COVID. Okay. So this kind of behavior also I see. Then finally they land up with my reference. Yeah, your appropriate doctor is Dr. Shailesh Umate. So this is a psychological fear where patient feels that they have a COVID, but we know that they don't have a COVID on the examination. It's a COVID phobia or COVID fear. This kind of patient also we are seeing a lot nowadays.
Can I add something to that?
Okay. Yes. Please go ahead.
Is a deceptive disease. So we have had a lot of times when we have had to convince people that what you're reporting could be very likely COVID, especially, when people already have pneumonia, and as soon as they walk in, we realize that this is somebody who's not going to, be all right in the next 24-48 hours based on what they report or what we, find on examination. But they find it difficult to believe because this is a disease. It's deceptive. The oxygen level drops last. In fact, we've had people walking into our OPDs with oxygen levels of 60, 70 in the first wave. And we were shocked because in our professional life, initially, we have never seen such dropped oxygen and people not reporting breathlessness. So the disease will not, make people too breathless when they have pneumonia. The drop in oxygen kind of creeps up. And this is why it is described as, happy hypoxics, because they really look fine, absolutely okay. But gradually the oxygen level is dropping. And when it drops really low, that's when they start arresting and, can have sudden deaths in the community. So that is what we are worried about, because if we pick them up, we can monitor them, be vigilant. The patients themselves can report their symptoms, monitor oxygen. Why has monitoring of oxygen become so rampant right now? Every house has got an oximeter. That's because we have realized that's the only way to pick up the disease, not by somebody reporting breathlessness, cough, or, they are not breathing fast for us to think that they are breathless. So that is why it's important. So convincing somebody to do a test have been challenging last wave as well as this wave, because those small fevers now get missed. Nobody reports a 99, 100 fever and they later on come with pneumonia. By then the fever sometimes have already gone away and they are not convinced. So that's one.
So do go on telling us, Dr. Priti, about the isolation, that, how do we really isolate and what is the difference between isolation, quarantine? I mean, these are two different terminologies, and what do we really do in this kind of a situation?
So isolation is when we are, keeping the person who is likely having the disease already, and they have COVID, irrespective of their PCR status, either because they have reported symptoms suggestive of COVID after being a close contact to a COVID person, or in this pandemic setting, as I told you, anybody with fever and all these symptoms are likely COVID unless proven otherwise. So as soon as you isolate yourself, you protect your family. You report your symptoms, if you have a room with an ensuite bathroom and a caregiver who can provide your meals inside and, deal with all the other emergencies, you put the rest of the family members, reduce the risk of the rest of the family members. That is isolation, because we are isolating a person who is COVID or COVID suspect. Quarantine is what we do to people who have not reported symptoms, who are just contacts. If you remember the last last wave, we were quarantining maybe, 50 to 60 people for every contact, because we were doing a contact tracing. Everybody who's had a contact with the COVID patient was getting quarantined. Buildings were getting sealed, hospitals were getting sealed. So quarantine is, you suspect that this person is likely to develop a disease, so you have to keep him in the separated from the rest of the community, because the disease can be asymptomatic. So this asymptomatic contact can go out in the community and spread the infection. So let them remain till 14 days from their contact period, and assure, that kind of assures you that even if they get an asymptomatic infection, they clear the infection.
Yeah.
And then they are free to go. So quarantine is what we do for people who are non-COVID healthy contacts. And the high risk contacts right now are the family members. Family members are considered high suspect. As of now, in this way, we are just quarantining family contacts. Ideal way would be to trace every contact, and if they've had a high risk exposure, ask them to stay inside for 14 days. But the kind of cases, the number of cases we have, I think it's impossible. It's impossible to do a contact tracing now, because we are overwhelmed with treating the patients. Right. So quarantine means you have to observe them for symptoms. So if they get symptoms, you test them. We know that the test may not pick up all diseases, so we also be vigilant for dropping oxygen levels, reporting cough, reporting breathlessness, or reporting loss of smell. So quarantine is to prevent the infection going into community from the high risk contact, and also picking up their disease early, testing them, and preventing a severe disease in the contact. So these are two aspects to why we quarantine. So we isolate the patients and we quarantine the high risk contacts.
Sure. And so when we actually isolate the patient, what should be, because for example, if a mother gets tested positive and the children are there, I mean, how do we really take care of the children? And it's tough at times that with young kids, it's not very easy. Forget about the younger kids, even the older kids at times are so attached to their mothers, or even with their grandparents. So how do we sort of isolate the young kids from the grandparents, and how do we isolate kids from ourselves if we are infected? Very tough. I don't know. I would like to have both your comments on it.
Dr. Umate, you have to start because it's more of a psychosocial problem right now.
Right.
Definitely, it's
For a first physician to say no, you isolate, and we just give them the orders, but then we kind of ignore about the challenges they have. The real life scenarios are quite different from what we advise a
Yeah,
patient.
I mean, I can tell you that if I was sick, my daughter will come down and hug me and say, "Mom, you're sick. Let me take care of yourself." And then they're too young to understand all that. So how do we take care of all this?
exactly. I mean, this illness has made us behave like this. In fact, in the past also we had a lot of infectious diseases, but we never separated our kids or loved ones away from us. But this is a testing time for all of us. We have to do it somehow. We have to explain to the kids. I mean, any kid which is 5 years and above can be explained, can be taught by the examples, like an adult taking a precautions, staying with a distance, talking from a distance, say 5 feet, using a mask and talking. So all this can be done. Okay, isolation, that doesn't mean that, or if you are separating that patient, that doesn't mean that you shouldn't communicate with this patient. That doesn't mean that you shouldn't get emotionally attached or talk with this patient. So if you maintain a distance of say 5 feet, wear a mask and have a conversation, definitely that can give a boost to the kids also, as well as the person who's isolated also. But for the kids, you need to lead by example. So any of the family member, adult, who's doing the same thing, sitting at a distance of say 5-6 feet, the person who's isolated in a different room, and another person is 6 feet away and talking, and then probably kids understand, there is something that we need to do. In fact, I'll tell you that all the kids in all over India over 5 years and above, they know about COVID-19, they know about coronavirus. In their daily talk, they talk about corona or something. Okay, so it is not that they don't know, but yes, we need to teach them, we need to educate them. These are the COVID appropriate behaviors, as Dr. Priti said. So this is how we have to behave. Okay, now once the patient becomes all right, then you can hug, you can be around, you can talk. It's a matter of say 10-14 days. Okay, you need to teach this to kids. And suppose the parent is in the hospital, we are very fortunate to have all the technologies with us, that we do video call, we do a chat, we do a talk. Okay, so that is little bit relieving, I mean, of course, during this time, it is a tough time for the parents, especially if one parent is having a disease, another parent is handling the kids. It is a tough time, I will share you my example when my wife got COVID. Okay, last year in the first wave, I was with my kids. So every day I have to kind of isolate and sleep with them. And when she was hospitalized, I have to talk, she has to talk on the phone. And my 5-year-old immediately recognized the background is different. Where is mommy? She's in a hospital. Okay, the moment again she came back home, the background is different. She's at home. Okay, so this kid used to sleep with me. And one day, I mean, he said that I can't sleep with you. I have to sleep with my mommy. I said, why? You're not good. I have to sleep with my mommy. And I said, you're talking to your mother, You're saying this, no, it is not video call. I want to talk. It is in person. I want to talk. Then I developed the idea of 6 feet distance. Probably we need to talk. So all these kind of things that you have to understand. And sometimes kids will give you tough time. Understand? Don't get emotionally driven by that. Just keep a focus, make them understand. Again, it is a matter of 10 to 14 days. You have to develop your lifestyle, and little they can tell you little worrisome fact. It will really affect your heart, but you have to go through this, and probably you will come out better if you do all these things.
Sure. I'll go back to a little bit more technical questions. When we talk about isolation or quarantine, should we actually wear masks in the house? For example, everyone doesn't sort of have unfortunately, doesn't have a large apartment where you could have a more number of bathrooms, and how do we then, if you have to share them, are there any tricks, Dr. Preeti, that you can suggest?
See, when you have an infected patient, we have to isolate them. I mean, even the government guidelines recommend isolating with an ensuite bathroom. So that is a given. I mean, you cannot break those policies. And so how do we work around it?
Yeah.
Now, last wave, everybody who didn't have this facility was getting quarantined or isolated in hospital. I mean, no facility isolation, facility quarantine was being done. This way we are unable to do that purely because of the number of cases, number of contacts. So when we have smaller houses awaiting reports, or how do we manage? You have to follow the same precautions: wear masks, maintain 6 feet distance, and keep ventilated rooms. So your risk definitely goes down when the ventilation there is a effective cross ventilation. So if there are challenges like that, these are the ways to work around the quarantine thing, or when you have smaller houses. But in terms of recommendation from the government, is only those patients can be managed at home who have facility to remain within a room separated from the negatives, and with an ensuite bathroom, with somebody able to take care of them from outside. So that is a given. We cannot compromise on that. Just
Sure.
excuse me for one more
Sure.
second.
While you take the phone, I think related again a question that I have for you, Dr. Umate, and that is that people not realizing that one, of course, we are taking care of our families, but we also have a social responsibility towards people in the society, people around us, and what we are observing is, since people are not disclosing, even while they're tested positive, what's the sort of mindset? And there are countries that we know, like for example, New Zealand, when last year the pandemic started, they worked with the fact that you should consider yourself to be infected and that you will be bad for the other. So having the other way approach is, they were able to zero down the cases. So can we also, people around, do you have a message that people will start thinking in that manner, thinking about others and not just thinking about our own families? Because we I don't know, correct me if I'm wrong, but that seems to be a concern right now, because that's the way the infection is fast spreading, maybe.
Yeah, definitely. The moment if you're kind of diagnosed with the disease, you have to take care of yourself. That so that you shouldn't spread the disease to other. That is your primary thing that you have to do. Okay, you will get better, and definitely treatment is available. But at the same time, as you were saying, that people are scared. Yes, they are scared. They feel that they will be looked down upon. They will be kind of stigma to the illness. So probably they are not coming up. But telling, it's not that you have to kind of shout and tell everybody that I am positive kind of thing. But definitely while you're going through the uh, lifts, or you are walking around, you can tell the watchman or the society people that yes, I am going through the lift. Please, I've been diagnosed with this. Please take care. So during that time, if another fellow passenger is not traveling in the lift, that is a safety for other people. The moment you travel and after some time other people are using the lift, that's fine. Okay. And again, in the house, you have to kind of take precaution, and you have to remain quarantined. In fact, many people are not following this because of the fear, or because they will be labeled something else.
Yeah.
They are not taking precaution. It is our responsibility that I shouldn't spread the disease across in the community, not towards my family members, but towards my fellow colleagues in the society also. I should ensure that it is my responsibility. The moment you don't come up with this feeling that it is my responsibility, you will not behave appropriately. And you're doing this for a good cause. In fact, all the medical people will be thankful to you.
Yes.
All entire medical population, doctors and all workers who are working in these facilities, any person is behaving in this way that he's taking care of himself and is not spreading the disease, we are really thankful to this person, because we are overburdened, we are overworked, we don't have a place. And if these persons in the society are there taking care not to spread the disease, it's a welcome move for each and every person. They have to do it, and it is needed for this time now. As the cases are picking, it's need of the hour that the person who's infected, who's diagnosed, shouldn't spread the disease to others.
Apart from that, I have a quick suggestion, and this is what we did in our building last week. And when we realized something like this is happening, and of course, it was not because someone was doing it purposefully, but just because they were not aware. And we actually, I made people come onto a Zoom call. I said, if not Zoom call, let's do a WhatsApp call, and let's all get together. Then it landed up to be a Zoom call because more people joined it. Everyone wanted to know about it, and we pacified them by saying that if we know that you're unwell, we're only here going to help you. And these, and then everyone came out to help out, and the entire scenario changed. The whole negative changed into positive. I think if more and more people in the buildings can start doing that, I think
Yes,
yeah, absolutely,
definitely.
we're going to
That's
bring down
that's
a burden on the medical fraternities right now, so
that's
to speak.
that's very good move that your society and you did it. In fact, the moment you kind of show care to any person who's ill, their approach also changes, so
Yes.
that stigma reduces. Okay, their fear reduces, and at the same time, you are making them aware. So lack of awareness is a very important point in the spreading the disease. Lack of knowledge, lack of proper knowledge about the illness is the main important point why this disease is spreading so fast.
Yes, and I'm very thankful to you for y'all coming here and taking out that time so that so many of the people around can understand. I mean, we also at the background have Dr. Lata Jamshamnani and also Dr. Mrudula Bhave, who has been with me. They are also helping out on spreading this program to as many as possible, so that we can reach this message to people and pacify them and get things into the right stride. Having said that, a quick next question, because we really have less time. But the question again is about if you test negative, and when you are, it could be false negative, false positive. Again, this question is for Dr. Preeti, because then people are lining up doing a CT. If in that case, should they be measuring? Should they have a oximeter at home? If they are if they're high risk patients, anyways. What are your recommendations when it comes to that?
If you've had a COVID patient at home, like tested positive or symptoms quite like COVID, so even if a test comes negative and somebody is progressing to have symptoms, we should treat them as COVID only. Okay, in such settings, we do a CT scan to diagnose COVID, because the test may not pick up everybody. So here CT becomes an important thing to diagnose. Okay, so CT scan also, if you do it too early in the symptoms, we may miss the diagnosis, because usually the pneumonia happens a little later, by fifth to sixth day, or maybe mostly in the second week. In this way, we are seeing people coming early with pneumonia, even young people coming early with pneumonia. So the most important thing is about the symptoms. If somebody has fever, is extremely weak, has got high grade fever, and you have a COVID person at home, if you've been tested negative, or there is a delay in getting the test done because of whatever limitations we are facing now, should get a CT done. And that CT will help you in diagnosing as COVID, so that based on the CT, you can be hospitalized or managed at home. So that the CT scan becomes a diagnostic test. The other times when we do CT is, to look for progression, because now we are all managing, good number of us are managing patients at home, because there is no facility to manage these patients. There, the CT helps us in diagnosing whether they are likely to progress to a severe disease, should they be hospitalized upfront, and if they have minor disease, how to manage them. The third thing is a good number of people, as soon as they're tested positive, they go ahead and do the CT, and then, but by then they don't have symptoms. Or just because somebody has told them do a CT, they do the CT and then the CT shows something and they're worried. So it's important to understand that if you don't have symptoms, whatever that CT report, and if you don't have, high risk factors, should not worry about a CT report. We are not here to treat a CT report. We have to see the patient in the setting of their risk factors, their illness, and their oxygen levels. So if you have PCR negative positive, but if you have symptoms, a CT is needed. The next thing is about these PCR and those CT values. A lot of people call us and say that, my CT value is so and so. There's a panic in the community based on that CT value that is there in the PCR report.
Yeah.
For me, it doesn't matter. You're either a positive PCR patient or a negative PCR patient. That CT value, whatever that comes in that RT-PCR report, has no value at all to a patient or to a doctor. For us, for us, it's important to manage our patient based on their symptoms and how likely are they, going to require oxygen in future. That is more important. That value doesn't tell us anything. Understand? So that whatever that PCR report reports, a good number of people call us asking, my CT value is 27, my CT value is 11. Doesn't mean anything to me when I'm treating that patient. The other thing about the CT scan score, a good number of patients, they're already aware that, there is a score of 1 by 25, 9 by 25, 22 by 25. So that score is basically to decide how severe is a pneumonia.
Yeah.
Again, for me, the pneumonia can be interpreted only in a setting of what my patient has. If the patient has no symptoms and some score of 3 by 25, we tend to ignore it because they are not likely to have any problems. At the same time, somebody says that I did a CT yesterday, that scan was reported normal, but he continues to have fever. For me, that patient likely is going to progress further and develop a pneumonia. There again, a negative CT scan doesn't make any difference because here what is more important is a patient's problem. So a normal CT, but having COVID, progressive symptoms, ignore the CT report, but go to the hospital or discuss with your doctor your symptom. Just because the CT says you don't have pneumonia doesn't mean that you don't have pneumonia. Similarly, if you have some minor changes but no symptoms, again ignore it. So a CT scan score, let your doctor interpret. The CT value on the PCR report, please ignore because it honestly doesn't come in any way in the managing of a patient.
Yeah. So he said it is essential for people to not panic and take it in the stride. And main thing which you all mentioned and Dr. Umate mentioned, you should trust your doctor and go to them and take the right inputs from them. Having said that, which she mentioned about the need of oxygen and Dr. Umate, you've spoken about an interesting concept of happy hypoxia. So if you could tell us a little bit more and how people react differently, and they're not even able to tell their symptoms rightly when they're in panic.
Definitely, before going to happy hypoxia, I just add to what Dr. Priti said. अज्ञानातील सुख आपल्या मराठीत एक म्हणतात. ते अज्ञानातील सुख आहे ना, ऍज अ सोसायटी मध्ये आपण विसरलेलो आहोत. Because as we are reading, we are knowing from things somewhere here and there, we are panicking on every little details of the things. Actually, very rightly said that CT score on that RT-PCR doesn't mean anything, but since we are aware of the things, it is unnecessarily increasing the panic. Okay, so people who had got severe illness and probably they were in the next or before the like losing their life, still they were happy that nothing has happened to me, and their doctor kind of treated them and they became all right. So that happiness we lost today. So we are kind of getting knowledge of each and every small details which is not required for us, and with that we are losing our peace of mind. Okay, that is what is happening. So we lost that. Marathi je म्हणतात ना, अज्ञानातील सुख जे असतं ते we lost that. Okay, now probably sometimes you don't have to go into details of what is there. As a patient, we don't need to know that CT score kya hai, ya wo CT count kya hai. In fact, Dr. Priti, I'll share you my example. I don't read much about COVID, the physical aspect of it. I know that Dr. Preeti and people in the society, they are there to take care of me. I don't have to go in details of the physical element. What am I going to do? I'm not going to treat myself. So definitely I have to come to you for my treatment if anything happens to me. So why unnecessarily read and panic yourself? People are doing it. Please, if they stop doing this, they will be happy. That is one concern. Regarding happy hypoxia, Rajashree, Dr. Preeti had already spoken about this. That initially she said that people don't complain the symptoms of
Correct.
hypoxia like breathlessness as compared to their oxygen level. So the moment any breathlessness comes, the oxygen level is less. But even though here in these cases, the oxygen level is 80, 70, the personal feeling of breathlessness is not there. The moment we monitor it, we see that the oxygen level is low. So that's why we call it as a happy hypoxia, because they are not feeling anything. So that's why actually very rightly mentioned, the oximeter is very important, that you should measure your oxygen level very rightly. And if it is showing low, below 90, you have to contact your doctor. So if you are in a quarantine or your isolation, apart from your temperature, you have to measure your oxygen, and daily you have to kind of note in a diary. And if it is going down, say 90, 92, you have to ask your doctor that at what my level I have to contact you. And you have to self-monitor yourself and contact your doctor. So because this is doesn't correlate the symptoms with the oxygen level. That is the only clinical observation that is not matching. Or the rest, as Dr. Priti said, everything matches, like fever, and rest of the things, your tiredness, weakness, body ache, all these symptoms matches with your disease progression, but oxygen level may not.
Sure. So with that, I think we've addressed a lot of myths, but a few more myths to address, Dr. Preeti. Of course, the ones we are seeing every day, something new coming up in terms of experimental medications, or all experimental therapies that are coming across the different types of treatments. It may not be only drugs, but a lot of other things that are coming up. What would you like to alert the patients with? Because every morning I think all of us wake up with the messages saying, "Is this drug available? Is that drug available? What do we do?" And all those questions are very stressful. If you ignore them, then they think that you're just not helping them. But what is the real scenario? If you could tell us, and then few more questions which have come from the audience, I'll ask them right after that.
So the first thing is that about people who are being managed at home, a good number of drugs are being prescribed, but it's important to understand that these are no miracle drugs. There is no proof that these drugs are specifically anti-COVID. It's a new disease. We have learned a lot in the last 1 year, and in that 1 year, whatever literature has come based on that, we doctors are prescribing certain medications. That is to pass on that whatever benefit has been, given by the scientific community, but none of these are miracle drugs. They are not like proven to be anti-COVID. So at home, what you have when you are having a mild disease is just the usual thing for a many viral disease, lot of fluids, paracetamol, and tender loving care, which because of the isolation we are unable to give, but that's all you need. Okay. Antivirals we are prescribing for people at home, but whether they really benefit everybody, we are not sure. So only people with symptoms really need those specific antivirals which we are prescribing. That also, if there is a problem of non-availability, it's not, as I told you, it's not miracle. It may not prevent some people from progressing to a severe disease. So when you're sitting at home, the most important thing about managing is to look for complications, to look for those oxygen drop rather than medicine. People sit with this, so this kind of illusion that, oh, I've been prescribed some medicine, so I'm going to be all right. Even if the fever is coming, I'm on certain medication. Don't sit in that false illusion that, because I'm on medicine, I'm going to get better. These are medications more for symptom relief, reduce the duration of symptoms, and at best, reduce the viral burden. In spite of these medications, there is a risk of progression, especially in people with high risk. Because all these are experimental drugs. Nobody has proven in the last 1 year that they definitely cure or prevent somebody from getting a pneumonia. So don't panic. Even if you don't get the medication when you're sitting at home, it's important not panic, but look for complication. As of now, what's the most important thing for people who get pneumonia is oxygen. So we are sitting at home and monitoring people likely to progress and require oxygen. So if they are likely to progress, we could give certain medications to prevent their progression and try to get them into hospital so that they get oxygen. That is, and then this disease puts you at a risk of, developing clots. So based on, again, your risk factors, we give you certain medications to prevent clot. Beyond that, it is just a viral disease, and what works is just symptom relief medication. So all those, polypharmacy that is being given by your doctors, and you sit and with the confidence that I'm taking the medication, I'm going to be all right, these symptoms will go away. Just don't sit. The most important thing when you're sitting at home is monitor your oxygen, monitor your symptoms, check your oxygen level every 4 hours, walk for 6 minutes, check your oxygen. If it is below 95, that means you have a relative oxygen deficiency. Come to hospital. If you have high risk, then better to be in hospital if you're running a fever. Any fever more than 24 hours, high grade fever, don't sit at home. Even if your earlier CT score was normal, I know CT scan was normal. That this means that the disease is progressing. CT is a one-time test, but the disease is dynamic. What is there today is not what you're going to have 2 days down the line. So we are sitting and anticipating problems and giving advice based on that. None of these drugs are miracle cures. So at home, please don't panic when you're not able to take certain drugs, because that's not more important. What is more important is vigilance monitoring for complications. The second thing is about in-hospital availability of these drugs. Same like home antivirals, even the hospital antivirals remdesivir have not proven that they are absolutely going to treat your COVID. We are giving because we want to put everything that into a patient whom we know if these medication work, we want to pass on that benefit. Why is a doctor prescribing remdesivir? It's not. We know that the studies say it may work, it may not work. But don't you want to have that benefit of if it works, why not give? That's why it's being prescribed. But say if it's not available, don't panic. Most important other care like ICU care, oxygen levels, sleeping on your tummy to improve your oxygen levels, those are also equally important. So even if certain drugs are not available, these supportive care might still take you through and help you recover from the infection. So that's important.
I don't know if you'll allow me. I want to share a few slides on nutrition, but and then we will actually get to the more serious aspect of why people are psychologically fearing the severity. But just as you mentioned, and it's as simple as you said that it's a viral infection, and all we can really take care of is symptoms. Even if people drill that into their minds, isn't will it not bring down the panic a lot and help people instead work positively to recover? But while I say that, allow me to share a few slides. I'm going to take about 4-5 minutes to share a few of them, because again, on the myth side, just as the drugs, there are myths on the nutrition side as well. So normally I'm the advocate of nutrition, but today I'm going to also talk about how overnutrition is also not the right thing to do. So these two things, if people don't know, but oxidative stress and chronic inflammation is something I want to talk about. These are silent and most dangerous. And these are what? These are not dangerous because they are dangerous really. They actually are mechanisms of immunity. So most of us now know that there is innate and acquired immunity. Innate immunity is our first defense, and acquired immunity is the antibodies that we get. And one of them is innate is fast. It comes up the first, and acquired comes up slowly. It develops and it's very specific. But having said that, we have to realize that when there is an immune response, what really happens after the infection? There are these type of cells, immune cells, which actually release inflammatory signals that recruit another type of immune cells, which actually release cytokines, and that actually cause the vasodilation, in the sense more room is created for more immune cells to actually come to the site of injury. And symptoms really start at this stage, where you start getting dry cough, fever, and this is the time when you should try to, my suggestion again, that you should try to isolate and quarantine if you realize that these are the symptoms you're getting right now. And then fluid start accumulating. There's fluid that starts accumulating into the alveolus, which are inside your lungs, and this facilitates the oxygen and carbon dioxide exchange actually. And what happens is when fluid accumulates, the alveoli start collapsing, and there is decrease in the gas exchange and increasing the work of breathing. I really want to emphasize these points into this session, because people need to understand that pneumonia can develop at this phase, and there is shortness of breath at this stage. So understand that your own immune system, because it's acting or overacting, these symptoms are occurring. And another type of immune cells called neutrophils, they are also recruited at the site of infection if the infection is more severe. And what happens is reactive oxygen species is actually released there, and that then also results in interacts with nitric oxide, and we get the reactive nitrogen species. These two, that is ROS and NOS, RNS, actually start they start destroying the infected cells. But what happens is, if there's too much of this ROS and RNS, then the problem starts, and that further will start enhancing the inflammation, and then inflammation will give rise to these more number of ROS and RNS, and then there's a continuous cycle which actually helps fighting the infections. However, if huge amounts get generated and if they are not quickly thrown out of our body, that's where we start having oxidative stress. And this is when there is a danger of actually getting secondary infections. And what I call oxy-inflammation, which is oxidative stress plus inflammation, they normally exist together, and which is when the patients are exposed, and this normally is seen in patients, which Dr. Priti mentioned, that when people have comorbidities or people are exposed to too much of environmental pollution, in those kind of cases, this can really get severe, and those people then land up into acute respiratory distress syndrome. Again, this isn't the case with everyone, but this is what has been published and seen in the first wave as well. And this is a time when people might need the ventilator life support. And in inflammation, once it starts becoming severe and the fluid starts, which is there inside the lungs, if it starts then going to the bloodstream and going to the other organs, then what we see is the system inflammatory syndrome, which is SIRS. And this, when it occurs, can actually result into septic shock and multiple organ failure, and can be fatal. So to understand that, our we have to take care of our immunity, and don't run after immune boosting medications. Now, immune boosting is what? I mean, are we trying to increase the immunity? No, we are actually trying to improve the immunocompetence of our body by trying to giving it nutrients which our body doesn't get in abundance. So in these times, it's actually more important, and I want to give more important suggestions when it comes to it. The American Society for Parental and Enteral Nutrition, ASPEN, has actually said that nutrition and hydration, these are two key weapons. So we have to use them in these times of COVID-19. So understand that, and there is a lot of evidence that suggests that poor nutrition status is associated with inflammation and oxidative stress, which in turn can impact the immune system. So I have some quick recommendations when it comes to critical recommendations in this pandemic. I would say, first and foremost, understand, because these are the leading societies from the world which are suggesting that you should hydrate and recharge yourself, because uh, so much of we have such a hot summer right now. We must actually revive ourselves by giving it enough amount of hydration. Drink water in first place, and then make sure that if you need to have electrolytes in these kind of times, or if you have an infection, it is ideal to replenish electrolytes and giving multivitamins and minerals along with it. That's one thing which I suggest. I also suggest that if you can give proteins, because proteins, again, to build the immunocompetence, give energy, and then it will also help in the process of recovery, and also mainly prevention. So that's the amount of protein you should normally have. But when it gets more critical, you have to follow the advice of the doctors and the clinical nutritionists, because that's the way to go. Don't just rampantly start consuming protein supplements. Make sure you're getting a lot of protein from dairy, vegetarian sources, and also non-vegetarian, a mix of them. And if you're not getting enough, then the older people, especially, or the ones with comorbidities, can look at taking supplementation. But make sure that you are getting the right crucial amino acids. So these are a few suggestions that I have from my end. If you can consume anti-inflammatory good nutrients or supplements, those are also ideal in case of people who have comorbidities. And then lastly, or firstly, it's balanced nutrition. We should eat half plate of vegetables, fruits, and whole grains, and protein should be 1/4 make sure it is enough hydration and good oils need to be consumed. But while we talk about balance of these macro and micronutrients, we should also learn that we should have a balance between alkaline and acidic foods. This is extremely important because this keeps inflammation lower in our body. And lastly, but not the least, we should make sure that whatever we eat, we're able to digest it well. We should eat fruits and vegetables, raw vegetables, fruits are not possible all the time, but because of COVID, if you're fearing it, eat steamed so that you can get enzymes. If not, you should take supplementation because all that you're eating, well, if it's not getting assimilated, and Dr. Umate will agree with me because if that sort of takes care, enzymes can actually take care of your gut health as well. And if your gut is well, then your the psychosomatic scenario is taken care of, and your brain is also at rest. If it is not, if you don't eat well, your it can have adverse effect on your on your mental health, and at the same time, that can then affect your gut health as well. And it's a vicious cycle. So take care of it. And most of us, of course, have been running these, including Dr. Priti and all of us. We are running these clinics or online clinics where we are giving all this support to people. At True Wealth also, we have been trying to do that. But we'll go to the next question. I do have few more questions for you and some questions that have come from the viewers. Unless any of you want to add anything on nutrition, please go ahead. Okay, so I'm quickly going to go back to a couple of more questions that are there. Of course, someone is also asking about. We spoke about the myths, but also, is an air condition okay to be used in these kind of situations? Is the question asked by one of the participants here, who's Nina. She's asking this question. Dr. Priti, that, and then there's also a question which I'm sure you wanted to address, is about steam killing virus. Prachi has that question also. So I think these are a couple of myths that we have.
We can use AC in our house if you do not have a COVID positive patient or a COVID suspect or anybody with any respiratory symptom, because obviously it's too hot and you need to have a pleasant life too. But if you have a COVID positive patient and there are challenges in ensuring those precautions, distancing and all, wherever a COVID patient is there and a negative person is going inside, or somebody without symptoms and tested negative, the caregiver goes inside. If there is a well ventilated room, the risk of transmission to others is reduced. Per se, use of AC is not going to increase or reduce the risk of getting an infection as long as you are in your own house. If you know that your biobubble do not have any suspect or infected person, when you go out your malls or the dining, outside you don't know. I mean, there could be one COVID suspect and you go to an enclosed air conditioned area, it increases the risk of acquiring COVID because it's recirculated air. Anywhere there is air exchanges and for fresh air comes in, there is a dilution of the virus particles, and that way the risk of transmission reduces. So if you are shopping outside in an AC room, people crowded together, your risk of getting the disease is definitely high. Using AC in your own home is acceptable, but going into an AC enclosed places, crowded places, may increase your risk of getting the disease. That's all in terms of air conditioned places. It's important to remember these 3 C's: crowding, enclosed spaces, and covering your mouth and
Yes.
nose. That's the only way. If you're in an open area, keeping safe distance, the risk of transmission is negligible
Yes.
when you are wearing a mask. But as soon as you go into an enclosed area which has got us AC recirculating air, even one patient can potentially infect the
Yes.
rest of the people in the next 1 hour or so, because a significant contact is achieved there. And there was this whole concept of airborne, or whether it is from surfaces. Basically, if you're in an enclosed area, even if you're coughing, there are aerosols that is dispersed in the air. Then
Yes.
the disease becomes airborne. But if you're safely placed from people and with a good air exchanges, there is no way those droplets will reach you, and then it will settle on the surfaces. So it is airborne in special circumstances. So what are those circumstances? In hospitals, we talk about when we are putting a tube to a patient, or when we are doing a scopy on a patient. But in a setting in a community, what is airborne high risk factor is closely enclosed spaces with AC running in, people screaming, talking, even singing choirs. choirs where even if one person is singing loudly, the amount of aerosol generated when you're talking, screaming and all is much high. Then for people immediately surrounding the person, there is a risk of airborne transmission. But when you're safely away in open area, the risk is more like a droplet transmission wherein a mask is adequate. Mask and distance and washing hand would be adequate there. So it may be airborne in special circumstances, and these are the circumstances. That's why it's important to avoid all these crowds and people screaming at the top of their voice, or coughing or vomiting in front of you. At certain places, the virus can be airborne in certain circumstances. Then the next question I think was about steam. You mentioned steam is not going to kill the virus. This whole the whole
Glad you say that.
it's not, it's the steam is not going to prevent you from getting COVID. It is not going to kill your virus by taking steam 100 times a day. Neither is consuming hot water going to kill the virus. This is just a fad that people feel and people are promoting. In fact, you will have enough WhatsApps wherein people are taking steam in steam area. I mean, it's really not going to help or prevent it. Only it contributes is to people removing their mask and breathing in and breathing out in an area and promoting infection. It is not a virus which gets killed by steam. So if you have congestion, if you have a blocked nose, you can take steam for symptom relief. If your viral infection is giving you sneezing, if you are uncomfortable, blocked nose, take steam. That is recommended for relief of your blocked sensation. But taking steam continuously to prevent an infection or treat an infection, COVID is not killed by steam. COVID is not killed by hot water. Please don't do that. You're subjecting people to a lot of burns. We know there have been kids who have come with burns purely because parents are making them do steam 100 times a day. And these burns are even more dangerous. In fact, you're hurting your mucosa and promoting worsening of infection.
Absolutely.
Please don't follow such things. Steam or hot water is not needed. When we have an acute COVID patient, they have a lot of ulcers in their mouth as well. The sore nose, the throat irritation. And then we see that they are taking hot water because there's a belief that hot water will kill it. The ulcers worsen. They are more, they're more symptomatic after taking all these measures. So none of these measures are going to help in treating or preventing COVID.
Sure. So amazing. I mean, I'm glad that you're really covering all those myths for us. A lot of questions I did try to club up, and we've been able to really answer to. But really now we come to the difficult question, because I think, and that's main thing where we want Dr. Umate's input is, because death is something which we all fear, and that's where all the anxiety sort of lies. That if there's someone who is really sick in our house and we're not able to get a bed, there's a lot of anxiety around. When the same patient then goes to, I'm clubbing 2-3 questions, but then when the patient actually goes to the hospital, he's alone out there. Does that kind of contribute again to the negativity and the fear? Does it contribute to more severity, sleeplessness, and so many of these aspects? And then of course the aspect of death when it happens. How do we take control of this kind of fear?
Yeah, very important question. First thing about getting admitted in the hospital or getting quarantined or getting away from your loved ones. Yes, definitely. That contributes to a negative mindset of a people. Because as you who get admitted or get quarantined, it is kind of your loss of freedom. Whatever you wanted to do, you cannot do it. And at the same time, as you've been diagnosed, there is uncertainty. I mean, what will happen to me, whether I will recover or not. So that uncertainty is there in the mind. And it causes a lot of psychological distress, boredom, irritability, a negative mindset. Okay. And it gives you inability to sleep, which is called as insomnia. Yes, these are the effects of kind of getting illness, getting into a hospital, which is again quarantine, frequent meetings as in the past. I mean, what in our society is there? If somebody is ill, the relatives comes over and meet you. Here, you cannot allow that, and it doesn't happen. In fact, your very close ones also can't meet you. Doctors and staff nurses also, they meet you in a certain particular period of point of time. So probably you lose that human touch here, but this is how the disease is. Okay, so this causes a lot of distress, fear, nervousness to the people. But again, you should keep this in mind that this is important as it is a part of treatment, and as it is that you're doing it so that you shouldn't spread the infection to the others. So here the cause is greater than your own pains and difficulties which you are posing. Another is it is for a limited time period. I assure you that, as Dr. Priti will also agree with me, this is 10 days to 14 days, okay, not more than that, or maybe 3 weeks. It may not be lifelong. So first thing that you have to keep it in your mind that yes, you are under suffering. Yes, definitely I am under suffering. There is a lot of problem with me. Accept it. Second thing, this I am undergoing with a definite period of time, like 2 weeks or 3 weeks. Through that, I'm going to come out. Third thing, because for any person, it is going to get develop a negative mindset. Okay, irritability, a lot of distress. But here, many of patients might advise that you imagine, okay, after 14 days, after 3 weeks of my this treatment, where I will be, what am I going to do? How will I develop myself? What will I do? All these images, if you keep on your mind, it will create a positive mindset. Okay, like after 3 weeks, I will get better. I have to do lots of work here in this aspect. I will go at home. I will meet my children. I will meet my loved ones, and probably I will go to work, and in work I will do all these things. That work could be in physical work or online work or whatever it is. So all these positive scenarios, if you're thinking, you're visualizing it, it will boost your mindset. Okay, it will reduce your negativities. So this mindset, by visualization you have to do it. It definitely gives you positive things. And again, if you are in a isolation or in a hospital, many of the times you lose the routine. You lose their social and physical contact. But now, as we are blessed with technology, even in COVID hospitals, the phone is allowed. If you can talk to your loved ones, definitely you talk to them. You try to establish a communication through a video call. A social contact you have to increase. You have to be here. I mean, usually I don't advocate social media. Okay, usually I try to tell the people that you use the less. But here, because there is nothing to do, you can be on a social media lots of time. You can update, you can see what is going around. You can increase your contact through this to all the people. Try to develop a routine. What happens during all this quarantine and isolation, we lose our routines. कि अभी क्या करने का है, पढ़े तो रहने का है, कुछ करने का तो नहीं है. No, get up at a proper time, sleep at a proper time, try to contact with all your people, try to develop a routine of your food timings and talking to other people. In fact, many of the people who were in isolation, who were admitted, they did their work. They did their work on through video calls. I mean, either their meetings or guiding to the people or kind of contacting their loved ones. Their 14 days of quarantine goes like this. I mean, अरे अभी तो था जैसे कि मैं मेरा काम ही कर रहा हूँ. If physically you can do that, definitely you can do that. And many of the people have come up with bright ideas during this people of time. So as I say, adversity is a new opportunity. So try to find out something new that you can do. But many of the times, why these people go into this negative mindset? Either they are on a blame track, in the sense of blaming entirely from China to the neighbors to some other people is first thing that we do. The moment you get an illness, कि इसकी वजह से हुआ है, इसकी वजह से हुआ है, ये कोरोना कब जाएगा, ये चाइना ने छोड़ा हुआ वायरस है. So the moment you are on a blame track, you are angry, aggressive, you are not on a balanced emotion, or you are on a shame track, in the sense, मुझे ही क्यों हुआ है, मैं ही क्यों. Very sad you feel that, you feel anxieties, uncertainties. Okay, both this track you shouldn't go. These are not right track. So what are the right track? Is the acceptance track. Okay, you accepted, okay, now the illness is with me. So whether I'm in a hospital or in a quarantine, now I have to fight with this illness. I have to come out with this illness. And definitely you can come out. As Dr. Priti has given you a good figure, 80% of these people are can be mild disease, so which can be treated, which can be easily, you can come out of all these things. So take this scenario. So 80% of the time chances are there that nothing is going to happen with you. You have to keep your positive mindset. Okay. And as I very rightly said, the duration of quarantine is less. Okay. Uh, you have to deal with your frustration and boredom. That is very important. And if you develop your routine, if you develop your contacts, probably you can come out of all these adversities. And as I said very rightly, visualize the positive things. What will you do after going out from here? And that will give a immunity booster, that will give you a positive mindset. And people have conquered illnesses which were not mean to. The diseases, deadly diseases like cancer, okay, which are years and years. Here I'm telling you just for 14 days. We have that 14 days or 3 weeks in a period of time. Through this, if you sell through these 3 weeks, you sell through this infection. So that you have to keep it in your mind कि ये 3 हफ्ता मुझे इससे लड़ने का है और इससे मैं definitely बाहर आ जाऊंगा या आ जाऊंगी. So this way you have to cope with this. So you develop a resilience through this. Like you have to keep yourself optimized and you have to believe in yourself. That self-esteem, if you do that, and as I said, if you manage your emotions, definitely you come out of all these things. These are my few suggestions. Who are in a quarantine or who are in a bed, definitely they can do all these things. Small things.
I was really going to ask you what techniques you could suggest to us, and this was really a great response, and we've learned so much actually. Just a couple of more questions, and we will actually have more takeaways while we leave. But one question, of course, is on someone is asking what multivitamin minerals to be taken, and my advice on that is I would proudly want to show this. This is a supplement that we are actually have designed, and the idea is to not only do multivitamins. It has all that zinc, selenium, vitamin C that you're talking about, but and of course copper, iron, ginger. It does even have you name it and it's there. So we have ashwagandha, all of that, but it's not. I would say it's all in moderation that you should consume over a period. Do not try to take high doses of vitamins and minerals, and keep this supplement actually has electrolytes, so it keeps you hydrated. So the idea is, even if you've gotten COVID and if you're having symptoms, it does keeps your energy boosted, and can just aid your immunity. That's what you should do, and that's why this kind of holistic supplement, which you can sip with water all the time, is what I will recommend. But one more question again, Dr. Preeti, for you, which is pretty much on the lines of the steam, but this is more relevant. If we should be taking hot water baths more frequently, and if we come from outside at this point in time, should we actually take care and take a hot water bath, and then do whatever we want to in the house?
So, I mean, it's not about hot water bath. You should just take a bath, take a bath, because that way, I'm coming from hospital. So for me, it's a given that I'm going to go wash my hands, discard my mask, remove my work clothes and take a bath and come. Okay. But having said that, this whole business of being so worried about surfaces, it's not really that relevant. Most important thing is your hands and that mask. But that hot water, I mean, I don't know whether hot water is going to make any difference, but yeah, you have to. General hygiene is very important. Hygiene is something that should be emphasized.
Yes.
That's most important. And hand wash. Hand wash is a given that you go and come out, wash your hand with soap and water. You don't need sanitizer at home. All you need is soap and water at home.
Yes. So I think we've really had a great session where we've addressed most of the queries, and also you all have really given such simple and positive insights. I would say that Dr. Umate said adversity is an opportunity, and ideally people should really think, learn, do so many things. Even if the students are not getting anything to learn, there's so many courses which are actually at such a lower price, and people should learn as much as they can in this time. This is a downtime that children should actually make use of it. Everyone should make use of it. And like you said, Dr. Priti, it's a viral infection. all we can do is take care of symptoms. Do not forget those basic principles and not panic, and do the basic right things. And again, both of you said trust your doctor. I think that is something which is very, very important in these times. And we still see that people are not very skeptical. So choose your doctor and be with them. And I have tried my best to get the best people on board out here today, so you know whom to reach out to if you have a problem. If you really have an infection issue, you can always reach out to Dr. Preeti, and if you want to settle down with your anxieties right now, who else can it be better than Dr. Umate, who can really guide you through all these times. That's the idea, to bring them on this show to answer your queries, and you know whom to go to. The last week also we did have Dr. Bhave on our show, and Dr. Kulkarni, and it was an amazing session where the problems with pediatrics and geriatrics both were addressed, and those were even more early times. But I would like to thank you so much for being with us today. I know, Dr. Preeti, you've been getting so many calls, and Dr. Umate, you've been doing a lot of hand-holding so many people, but you took out time and you came here and answered all the queries of the people who are attending in Zoom here, and also people who are outside watching us on the live platforms as well. I would like you to end the show by giving us the takeaways, really, and a few takeaways which we drill into our heads and sail through. Like you said, Dr. Umate, we're going to sail through this soon.
Yeah, it's one day at a time. Just do your work. We are all going to sail through. Everybody does their job and it's going to be fine. We all go to work with the same intention every day. And we're getting, things are getting better. So let's hope that we will tide over this phase as well.
Surely,
and
the humanity is going to be there.
We should get vaccinated.
Oh yeah.
Vaccination is important.
That's the only way to break the chain. When every one of us are immune, that it becomes a very low grade disease, and then we are not worried about this kind of spikes. So vaccination for all.
Definitely. What I want to tell you is, yes, it's a virus. It's a virus that has affected humanity. In the past also, we had such a kind of viruses, flu. If you go back to the history 100 years back, it has also kind of done the same thing, all the humans all over the world. Now, after 100 years, again, we are having this COVID virus. But that time also, humanity has sustained, and today also we will sustain. We have to just think of our good deeds, and we have to think of ourselves, as well as we have to think of our society. The moment we are thinking of ourselves and we are keeping in loop with the society, we kind of will come out of all these things, and definitely we will win whatever it is, and we will be in a good position, definitely.
It's a collective responsibility of all.
Absolutely.
Yes.
So I would like to thank the viewers for coming down and watching, and of course, encouraging us by coming here, keeping the balance with health, as Dr. Preeti said, nutrition, and of course mind, which is the most important thing I think we all have to stay with. So I would say stay home, stay positive, and keep doing your work, just as Dr. Preeti said. So we will end this session today, and we will try to come again with any queries if you all have too many through this pandemic. But I would like to thank both Dr. Shailesh, Umate, and Dr.
Thank you, Rajashree. Thank you, all the participants. Thanks a lot.
Thank you.
Sure. I'm going to leave you with a small promo of RSG Energia, because they're the ones who actually keep supporting us through all these technicalities of the programs, and also circulating it through many groups, and taking it to multiple different channels. And they have relentlessly done that for us for the last, now it's one and a half year that we have been doing these programs. So I'd like to thank everyone and play this promo to end the program with.